We have with us Dr. Harish Shetty, the name that needs no introduction. Consultant psychiatrist of international repute. Dr. Harish Shetty sir is also an excellent orator. He has been into clinical practice since the last 33 years. Dr. Harish Shetty sir has done immense work in suicide prevention with students and teachers. He's also the visiting faculty at SNDT and Mumbai University. He's the president of the NGO called My Home India. And sir, as always, will now enthrall us with his walk the talk. May I request Dr. Harish Shetty sir to please take up the stage and say a few words about the program before we begin the question and answers, please. Over to you, Dr. Shetty sir.
Sir, please unmute yourself.
I congratulate the Association of Medical Consultants, my oldest friends, Hemant, Nilima. I think it's a phenomenal initiative. And I think that this is just the beginning of a long association with mental health. And that I think is so, so beautiful. Happy to be with Reena, the erudite professor of R.N. Cooper Hospital. I have a fond association with the hospital, ma'am. I've worked there for a long time. And I live very close by. Milan, again, a young Turk, young mental health leader, always active. He's silent, but he has a lot of depth, a lot of understanding of mental health. His perspectives on mental health have been phenomenal and fantastic. Akanksha, again, a great mental health leader, living probably in the suburbs. I don't know where she is now living. She used to live at Andheri.
I still am.
I'm still there, okay. And working phenomenally, very enthusiastic, very enlightened. And I'm so happy to be with all of you. And congratulations, AMC, for taking this lovely initiative. And we promised the audience that don't live halfway. You are not here for the points. You're not here for the MMC points. You're here for the mental health points. And let me also accept that the audience and the panelists, we're all in the same boat. If you're saying something to you, it applies to us. We're not God's gift to the human race. We also have our own vulnerabilities, our own issues. And we are not immune to the advice we are giving you today. We are all in the same boat, and that's something I need to share. Thank you, Akanksha, for really doing this. Thank you, Milan. Thank you, Reena. Hemant Dada, thank you. And Nilima, fantastic. Fantastic. We still have not seen your colored pictures on the Facebook in the festival. You have to put more in the next few days. Thank you, ma'am.
Thank you so much, sir. Today's session is basically focused on how to deal with burnout or how to have wellness. It's important not just for doctors, for every common man, but as doctors, wellness becomes all the more important for us because we are caregivers. We are caregivers, we are first contacts for patients. Until and unless we have our own wellness in place, it's very difficult to support someone else. Just as Dr. Vani ma'am said, the announcement in the flights, wear your own mask first before trying to assist others. So before we begin about how to deal with burnout and before we take up all the questions, let us first try and understand what the concept of happiness is all about. May I request Dr. Shetty sir to please enlighten us on what exactly is happiness that we're trying to pursue here?
Happiness is something which you can't chase and you can't avoid. Always understand that when a doctor goes to the market sometimes or for a movie or is sitting in a restaurant, somebody comes and taps him from behind and says, "Aapko yaad hai? 15 saal pehle आपने मेरा ऑपरेशन किया था, आपको याद नहीं होगा, पर उससे मेरी जिंदगी बदल गई." And this happens to us all the time, and that is happiness. You can't chase, you can't avoid. It comes to you as and when it has to. You cannot chase. And what is very important to understand that you can't focus on happiness. You have to focus on peace. Happiness is a byproduct of peace. Very important for us to understand. And remember, differentiate happiness from pleasure. काफी ऑडियंस में लोग हैं जो कहेंगे हम माइक ऑन करेंगे, हम स्क्रीन ऑन करेंगे और अपना काम करेंगे, हम व्हाट्सएप पे काम करेंगे, हम खाना खाएंगे, हम घूमेंगे. ऐसे मत करना यार, ये वंस इन अ लाइफ टाइम शो है. तो प्लेजर इज, अरे हरीश शेट्टी क्या बोलता है, रीना वानी के पीछे काफी फोटोग्राफ्स है, अपने को तो 2 पेग मारना है, दैट इज प्लेजर. अरे यार छोड़ दो ये सब, आज शाम को हम सब मिलेंगे, वो प्लेजर है. So that's very important for us to really differentiate the nuanced separation of happiness and pleasure. And if anybody believes he can be happy all the time, that means he's smoking weed or hash or cocaine. Kangsha, so it's like chase peace. Happiness is
Absolutely.
a byproduct of peace.
Absolutely. So very, very well said. And I would definitely like to add that chasing peace or chasing happiness also is it's not a cross-sectional thing. It's a longitudinal process. Just like we all take care of our physical health, we all exercise, join gyms and Zumba classes and fitness centers and whatnot. In the same way, I would also urge everyone here today to actually go and chase. We will obviously be discussing activities on what to do to chase that fulfillment, but that should be a part of our everyday life. It's not a one-time activity. And let me take up the first question Dr. Pranav Kudyal has put up in the chat today. How to deal with burnout? As a doctor, we've all faced this. We are overworked, overtired, surrounded by too many questions, WhatsApp messages, even after the OPD hours and after the working hours. How to deal with all of that and still have the peace of mind? Can I request Dr. Milan sir to please take up this question?
Right. I think that's something that is the focus of this talk, right? Something we may sometimes dismiss as a sort of Western concept that, they get burnt out, we don't. We have support systems, we have families. These are things that I hear often talked about, that we have families and support systems, so we don't need these concepts of burnout, and it doesn't happen to us. But I think that's something that we need to really look into and introspect as a community. As a community, we and like Hari Shetty said perfectly, that this applies to each of us. Not coming from a place where we say we know more than you. We're just trying to share some of our thoughts, and also absolutely happy to listen to what other people have to say. And so as far as burnout is concerned, just as we sort of educate our patients about prevention of illnesses, often we must also focus on prevention of burnout in our own lives, both professional and personal. Sometimes we have a lot of people who are doing great in professional life, and they may be completely burnt out on the personal front. I think that's something that we can't neglect, and we can't look at one aspect as being fulfilling while the other not being there. So there is a need for a lot of soul searching, a lot of asking ourselves questions, asking ourselves simple questions like Hari Shetty said, just what is it that brings us joy? What is it that makes us happy and peaceful and really there? We want to focus on those things, focus on how to find more of these things, and also how to weave them into our personal as well as professional lives. So also simple things like learning to say no. That's something maybe that will also come up in our discussion as to how to assertively say no to certain things that you don't want to do, and pay attention to the little things, finding time with family, friends. And I really think it's important to look for one very important thing that we need to look for is good mentors. I think I have been very, very lucky, whether it's in psychiatry or otherwise. At the Bombay Hospital canteen is where I found most of my mentors. Frank, I may have added some weight as well, but that's been very helpful. I found some very prominent mentors, and you found these big names who were absolutely down to earth, and they spoke to you like a father, and they really guided you through all these little things that we really talk about. It just came out. I think those are some things that we need to, and if we don't find those mentors, we need to actively search them out. We need to find those people who are similar to us, people that you think look like the people you want to be, and find from them what we need to learn. So I think that's, and most importantly, I think it's very safe to ask. You should never be afraid to ask. People are willing to help. You need to only be sort of prepared to ask. So I think those are some of the things that we need to do. Would be very helpful in sort of prevention of burnout.
Absolutely.
Kanksha,
As Dr.
I would
Vani-
like to just add, that's why I've raised my
Definitely.
hand. I'm not a psychiatrist, but I feel that all doctors have to be counselors for their patients and for their, like I'm in a medical college where I have to be counselor for a lot of the residents. And one of the delegates has already put up a question. When you're in a very low mood or a very low self-esteem mood, how do you be happy? Now, you yourself spoke about you have to chase happiness. But somebody has said happiness is like a butterfly. The more you chase it, it's going to run away from you, which actually is true. And in fact, that reminds me of this wonderful, I'm sure all of you have heard it, about when John Lennon was asked, what do you want to be when you grow up? And he said, I want to be happy. And the teacher said, oh, you didn't understand my question. And he says, you didn't understand what life is all about. And that is, actually so true. So here I feel that, people hesitate to reach out to professionals. I have seen that in medical doctors also. So as a non-psychiatrist, I feel we have, first of all, Milan has given a very nice overview, but we have to be ready to reach out for professional help. And it's a combination of counseling, and sometimes you need to take medications for mental health to break that vicious cycle. And a lot of doctors, especially in the medical profession, have this taboo or stigma. I cannot take tablets for mental health. I tell them that you take tablets for thyroid, you take tablets for BP, you take tablets for diabetes. Why can you not take a tablet for mental health without stigmatizing yourself? And I think that is something which we really need to change in all our doctors. So I feel as psychiatrists, you need to break that barrier or the taboo which people have. कि मैं तो health के लिए गोली लूंगी, लोग सोचेंगे मैं पागल हूँ. That has to change. So I think I would hand over back to the psychiatrist, but I just thank you for letting me just say this because I felt it was really important. Thank you.
Absolutely, ma'am. And your input was absolutely important and relevant at the same time. In fact, burnout is something that we see more so in surgical and branches which have to deal with emergencies.
One sec.
Yes.
I would so be happy for Reena, Hemant, and Nilima to butt in with their insights, because mental health is not our business. As the Prof. Senan Vig said, mental health is too important to be left to mental health professionals alone. So I want to add something about burnout. Again, we did not say chase happiness. I said happiness cannot be chased and cannot be avoided. What is burnout? So सुबह सोमवार को ऐसा लगता है यार आज हर्निया पोस्टपोन हो जाए, यार वो हिस्टेक्टोमी नहीं यार नहीं परसों करेंगे यार वो, and you flowery words come inside your head in Hindi and Marathi. Absolutely Oxford language goes through your mind. Physically you feel drained and you don't feel nice, and it's symptoms of burnout similar than of depression. Only thing is burnout changes when you change your lifestyle. हिंदी में मुझे कहना है, अपने जिंदगी के मोमबत्ती दोनों बाजू से मत जलाओ यार, काय को. और एक बात, 10 जगह अटैचमेंट क्यों? नहीं वो ब्रांडेड हॉस्पिटल, काय का ब्रांडेड हॉस्पिटल? You are the brand. The day when consultants believe they are the brand, they live much better than the others. You can't be traveling and eating in the car. You can't be traveling across 30 kilometers for an attachment, then practice somewhere else, then practice. There was a psychiatrist who had a clinic in every suburb. Why this insecurity? So before getting burnt out, ask yourself, तुम्हें जिंदगी में क्या चाहिए? नहीं मैं गोल्ड मेडलिस्ट हूँ, वो साला उसको मैं हेल्प किया, वो मैंने हेल्प किया इसके लिए, वो पास हो गया, उसका 3 हॉस्पिटल है यार, रुक जाओ यार, stop, pause. I believe in practicing 10 minutes away from my house. Home here, hospital there. Hospital, I got the attachment by mistake. I went and accidentally went to meet Arun Shetty, and he said, "आ जाओ ना 1 घंटे के लिए." वो भी नहीं जाता था. So what is important is 3 things. to prevent burnout. कितना एंजियोप्लास्टी करेगा कितने हॉस्पिटल्स में? And all those guys who are seniors, दे दो ना, तुम्हारे बहुत बच्चे हैं यार, they do very well. Pass it on यार. और कितने मीटिंग्स में जाओगे, कितने एडवाइजरी बॉडीज में अटेंड करोगे? काय को? क्यों? The burnout is asking yourself, मेरी जिंदगी की फिलॉसफी मुझे क्या चाहिए? मैं इस पृथ्वी पर 50, 60, 70 साल, आजकल 40s भी is equal to 70s. So that is number one. Number two, when you leave your house, how do you leave your house? Do you hug the loved ones? नहीं, कल बहुत बड़ा झगड़ा हुआ, अरे झगड़ा होने दो, पर चिपकने का 1 मिनट के लिए, स्मॉल चिप को देने का मूड अच्छा हो जाता है. Hypothalamus releases chemicals. Or when you enter the hospital, smile at the security guard. They are the people who respect you the most. Your colleagues don't smile at you as much as they should. They are talking about how your patient was snatched by somebody else. Security guard. Greet the nurses when they greet you. They always greet you, but most of the consultants walk past them. Simple things, as Milan said beautifully. And also, my dear friends, remember, पेशेंट मरने के बाद है ना, आधा 1 घंटा क्लोज रिलेटिव के साथ बैठ के बात करने का. बर्नआउट इज ऑल अबाउट हाउ मोमेंट टू मोमेंट तुम्हारा जिंदगी कैसा है. इट्स नॉट अबाउट डूइंग एक्सरसाइज अलोन. इट्स नॉट अबाउट स्पेंड क्वालिटी टाइम. व्हाट द हेल इज क्वालिटी टाइम? पीपल आस्क मी. इट इज अबाउट लिटिल थिंग्स, रिस्पेक्ट, ग्रीटिंग्स, affection, compassion to almost everybody around. You may be in the biggest. I have this habit, Akanksha and Milan and Reena and Nilima. Reena and Nilima. Whenever I'm in a car, I just wave at people on the adjacent car. I say, and when you wave, many of them don't. They just keep their face taut and they don't smile back. Arey yaar. Small smiles, small greetings, respecting the people on the lowest order of hierarchy. Asking them up khana khaye and walking past the security. You actually work on hypothalamus and see to it that your hypothalamus, pituitary, adrenal axis remains taut. And whatever happens, visiting card पे अपने को जीने का ही नहीं. हॉस्पिटल के लिफ्ट में कोई भी मिला तो हेलो बोलने का, हंसने का. कैसा चल रहा है यार? कोई भी मिला. It could be a watchman, it could be a ward boy. So the more you live as a human being, less chances of burnout. The more you live in your visiting card, more chances of burnout. So my dear friends, to summarize, number one, you are the brand, not the hospital. Ask yourself, what is it that you want to do in life? And number three, काम पे निकलने के वक्त झप्पी और सोते वक्त कुरवाड़ने, cuddling, बर्नआउट कम होता है. Feeling the breath on each other's face, कितना भी झगड़ा हो, 5 मिनट का cuddling, 10 सेकंड का hug. And that, I think, these are the small things by which you can prevent burnout. But there's so much to say, Akanksha. Go ahead. Sorry for really butting like this.
Absolutely, sir. We require all those inputs. In fact, I would like to invite Dr. Nilima ma'am and Dr. Dugar sir also to please share their inputs on burnout, on their personal experiences with this.
If you really want a personal experience, Harishana, just now you just said, that when you are in your car, you say hi to everybody around. Believe me, I've been doing this for years. And one very small thing which happened in my life, let me tell you, I am a music person. So whenever I'm in my car, and please remember this, kahin bhi aapko jana hai, time pe niklo, do not be in a hurry to reach your places and enjoy the journey. मैं म्यूजिक लगाती हूँ, मस्त एंजॉय करके चलती हूँ. कितना भी ट्रैफिक हो, it just does not affect my psyche in any possible way. That is the time to enjoy yourself, because once you go into the hospital, you are going to come across faces who are in pain and you are going there for relieving their pain. So for you to be in a pleasant phase of mind is extremely important. Or Gana baja ke, I do my dances and I'm doing all that on my wheel, on my driving wheel and at the signals. And one fine day, I had a group of boys who were following me around, and I was getting agitated. Why are they following me? So next signal, they stopped and they said, "Ma'am, please roll down your window." And I rolled down my window. He said, "We have been following you for the past 10 minutes just to see how happy you are and how you're enjoying the music in your car." And that was such a happy thing to happen to me. And these are the kind of small experiences. Wishing your liftman a very good morning. I have started going to my business Summit Bay office at AMC very regularly. I know all the liftmen. I know all the people in my on my floor. I say hi to everybody. And believe me, Arishana, it really gives me a lot of pleasure. And those are the small things. Listening is an art which every one of us should develop. Listen to your patients. The more they talk, the more they come out with their problems, the better diagnostic and a better clinician you become. More than you talking, let the person in front of you talk. And no greater pleasure that person has, by emptying out his own heart to you. So be a very good listener. That is one of the best doctors you can possibly be to your patient. Thank you.
Thank you, ma'am. And I think, as Dr. Bhamre rightly put it, listening. So as a psychiatrist, or be it any other doctor, listening is really an art. It's a skill that you have to learn and develop over the years. That's absolutely very important. Just to summarize about what we spoke in with regards to burnout, as Dr. Milind Balakrishnan said, that professional and personal, there are both the areas, both the domains of life where we have to work on reducing the stress level and the burnout level. Having a mentor and a guide. I want to add Dr. Duggar's input also, and sir, requesting you to please give in your personal experiences.
For me, the simplest thing is I have trained my mind and myself to forget. Any situation, good or bad, just don't carry any baggages. The early you throw it off, the better you are at peace with yourself. And what Harish said, that happiness is a byproduct of the peace within you. That is exactly everybody has to learn and understand and imbibe. See, more often what happens is that we, being intelligent medicos, we know all this, but then majority of the times it remains for the preaching. We forget ourselves that it has to come within us, and for that, what solution I have found myself is just try to forget as fast as possible, so you don't have anything in your mind and you don't have any bad feeling. So no burnout, no sorrow, no nothing. Every time I am new, I am fresh, I enjoy. And I think that what I feel within me is my happiness, because the problems are everywhere. Within you, your family, society, your hospital, your patients, where not. And but then if you start carrying it together, I don't know how much it will pile up to. So that's my way of reducing the burden and trying to get that peace and happiness. Thank you.
Thank you, sir. In fact, what you said about forgetting and leaving your burden soon, that reminds me of a very beautiful story of two Buddhist monks who were waiting on the banks of a river, waiting to cross the river. They found a lady there, beautiful lady, who wanted to also cross the river, but she could not swim. She was not a swimmer. So she requested the monks for their help. And initially, they were a little hesitant to carry the lady, to touch the lady. But then eventually they agreed, because help is what they've been trained to do. So both the monks, they carried the lady and swam across the river. They dropped her off at the other shore, and they went on to their journey. A little ahead, one of the monks said to the other, "Don't you think we committed a sin by carrying that lady and helping her cross the river? Don't you think that we should not have carried her?" And to which the second monk replied, "My friend, we both carried her, but I left her at the shore. You're still carrying her." So I think that's really important to forget and give away our burdens and whatever we are carrying, taking up our mental space and our neuronal space. Definitely that's a very important tip, sir. So just to summarize, we spoke about burnout on how to deal with in professional personal fronts, and Dr. Nilima ma'am spoke about listening. Dr. Harish Shetty sir gave us very, very valuable inputs, not to run from hospital to hospital and maintain a good work-life balance. Dr. Vani ma'am gave us a very, very important input that taboo and that stigma against mental health, it really needs to be addressed. It has definitely improved post-COVID, where people are more aware and they are at least talking about it. But yes, when it comes to the implementation part, I think we are still a little lacking. And maybe just one thing that I would like to add here with regards to the implementation. If I were to give you just one simple strategy today, so I want you all, you're all senior consultants and working in your field and experts in your field. But if you can take just 2 to 3 minutes every day to follow this one simple activity, it will just require a pen and paper or a simple diary and a pen. I want you to all take 2 to 3 minutes and write down 2 things on that piece of paper each and every day. One would be expressing a gratitude or a thanks to somebody who helped you in the last 24 hours. That's the number one thing. And the second is write down one positive experience, something good that happened to you during the last 24 hours. I would strongly urge all of you to take out time, 2 to 3 minutes, to write down these 2 experiences every day. If you do it, continuously for the next 21 days, write down these 2 things, I am sure you will start seeing a positive change. So that is one thing I would like you all to go ahead and please do. Dr. Vani ma'am, yes.
I think, Akanksha, you've really beautifully summed it up, but 2 small inputs. What you talked about writing it down. In COVID, in my own family, my daughter, who is the youngest of the family, took out a glass jar. She had to come back from the university and was very depressed because she couldn't do what all she wanted to do in her studies in the US. And she gave one to her brother and one she kept for herself. And said that, because everyone was feeling low and depressed. And it was, let's fill up our jars. It was labeled a happy jar. That anything, exactly what you said. And to be honest, when we saw, and as parents, we were not allowed to open the jars, but we saw those little chits of paper filling up the jars. And that was what helped to, keep that mental balance. So I think what you've said is a very small but a simple thing. And what Harishanna said about little things and what Nilima also said, especially when it comes to adolescents and children, what we think are little things are actually very big things for them. So that distinction, and even for ourselves, what is a big thing and what is a little thing, we have to draw those Lakshman Rekhas or lines for ourselves. And it is actually the little things which matter, not the big things like who is going to demonetize the note or what is going to happen at the national level. Nobody remembers that. What we need to do is the little things which are going to make a difference in our day-to-day lives. So I think to deal with stress, these are 2, 3 very important points which we need to implement, which can be done in day-to-day practice, what you can change. This reminds me last about that serenity prayer. It's also a very old saying, but it's something which I have also written down and given to my children on their 18th birthday. That God grant me the serenity, the courage, the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And I think that is something which we have to start implementing in our own lives, even as doctors, that what we can do and what we can't do, when we can operate, we can't operate, which patient we can save, which we can't save, and to live with that choice and then not carry that baggage. Thank you.
Correct. Very, very well said, ma'am. And about the little things, that it's a very subjective feeling, what may be perceived as big or small by someone, which actually brings us to the next question, which was put out here by Dr. Sachin, that how to deal with adolescent children when they get angry and adolescent children's rage when parents are not giving enough time at home. Can I request Dr. Harish Shetty sir to please take up the question?
teenage as of now has been difficult also because they have been locked and they have become teenagers suddenly. They did not know that they've become teenagers. And in schools, we see a lot of kids very abrasive, very aggressive, and saying, Kya be? They're speaking to their teachers, Kya be? And teachers are also very. There are 3 or 4 things. Number one is that, are you an inspirational parent? Are you a very authoritative parent? Are you an indifferent parent? Or are you an empowered parent? If you are an inspirational parent, sometimes children dote at you, they model after you and they imitate you, and things are much better. But if you're an instructional parent, and India में 130 करोड़ प्रवचनकार, and then you had it, and they're not aware that we instruct. I'm not talking about the person who asked the question, I'm talking about generally, even to me. Then you have an authoritative parent. Mala's माहिती आहे काय खरं आहे आणि काय खोटं आहे. But if you're empowered parent, which means, as Nilima ji said, sorry, not Nilima ji, Nilima said, आपके घर में empowerment के लिए क्या-क्या tools है? And I still remember my son asking me a PSP4 long ago. मैंने बोला नहीं यार वो ठीक नहीं, तो तुम बैठोगे उंगलियों से खेलोगे, हाथ पैर से नहीं खेलोगे. माफ करना मेरी अंग्रेजी इतनी अच्छी नहीं है तो बीच-बीच में हिंदी में बोलूँगा. We have to stop English at some point of time, and in Madhya Pradesh they have started MBBS college in Hindi, and slowly we'll find local languages getting stronger across the country. So he wanted PSP4. We discussed, and I find it was not of any use. He said, no, Daddy. And we went on talking for 2 years. He said, no, that boy took and his marks improved, and all that happened. But the point is that I did not insult him. I did not humiliate him. I said, चर्चा संवाद चालू रहेगा, बातचीत चालू रहेगी, बीच-बीच में चुप बैठा आधा दिन, 1-2 दिन खाना नहीं खाया, but दोस्ती हमारी कभी नहीं थी. It's important for all doctors to understand that families and schools are places of personality development. They're laboratories of personality development. And when you allow that to happen, most of the aggression can be managed. But as we know, teenagers are different. Sometimes they're moody. They might be very, very, very angry in the morning and extremely docile in the evening. But when you have a teenager who's very aggressive, there are 5 things you need to see. First is sleep barobar hai kya? Because sleep is not about arithmetic, it's about architecture. Number 2, is he sleeping with his phone or is he sleeping alone? Behind the chadar, you see blue lights coming, and children don't have time to talk in the day. So that also is causes a lot of aggression. Number 3, is he really struggling with something in his mind? Yeah, that girl left me, that boy actually left me. My friends don't speak to me anymore. I don't think I can do this NEET at all. And father is saying, dude, I'm a person of humanities. I don't want to inherit his hospital or inherit his or her legacy. Again, very important. 5th is a lot of boys and girls have nutritional deficiency. Vitamin D3, 4, 5 from upper class families. A lot of these kids have very bad nutritional deficiency. Number 5. Are they vaping? Do they actually don't like the way you deal with your brother, father, mother? And there are so many things. So if there's a lot of aggression and you really cannot handle it or really cannot manage it, we run mental health garages. Meet the nearest psychologist or psychiatrist, friendly neighborhood psychologist, and let somebody else look at it. Now you will say, ये 25 साल की psychologist या 28 साल की psychiatrist, इसने जिंदगी नहीं देखा है, बच्चे नहीं हुए, ये क्या समझ पाएगी? No, yaar, they're trained. So that is something you need to. Kids who are calm, in my experience across the last 33 years, they have 5 attributes. One is they do household work. अपना underwear खुद धोते हैं. Even if you have घरघाटी, even if you have maids, etc., they wash the underwears. They help their parents in household work. They help in groceries, though you can call everything on the phone. They're doing household work. Number two, those schools where yoga is there, yoga is practiced, those kids are much calmer, much calmer. Those schools where kids are in complete interaction with nature, they're much calmer. Tribal schools, kids are very calm. I've been to them across the country so many times. Number four, which is also important, we are introducing this new thing in schools. When I go to school, I ask kids to touch the feet of the parents. It has nothing to do with any religion. It's part of our Eastern culture. Yeah, small kids, the way big kids might not actually do anything as of now. And when they said, the people asked me, why should I do it? I said, when a child touches the feet of his parents, he bends. He becomes grounded, humble. And when the parent bends down and lifts him up, both become grounded and humble, and there is bonding. Very, very, very important for them to really come. And second thing which I've been saying, telling all kids, there's nothing like unconditional love. Baba, माँ बाप तुम्हारे आज ख्याल रखते हैं, तुमको बड़े होकर माँ बाप का ख्याल रखना है. कहीं भी जब तुमको यूएस जाना हो, उनको ले जाओ. So the unconditional love is sometimes overrated. So we tell them to do this. Now with this bonding happening, things improve. Lastly, my dear friends, doctors have little time. And quality time. Quality time म्हणजे काय ते विचारतो आम्हाला. There is nothing like quality time. It's the intensity of contact which is more important than the duration of contact. Which means what? Which means if you have 10 minutes, see if you, all doctors, please bear with me for this long lamba lecture. देखो भाई, जब तुम्हारे पास समय कम होता है ना घर में, तो क्या पूछते हैं, FD रिन्यू किया क्या, बिल पे किया क्या, उसकी शादी में कौन जाएगा, तुम जाओगे कि मैं जाओगे. And when you have a little more time, you share feelings also. So, but we have paucity of time. So in little time, you share thoughts. More time, you share feelings. So what do? We look at the intensity of time. यदि 20 मिनट भी है ना, फोनवा को बाजू रखे. भाई बच्चा कैसा है रे तू, उसके साथ ब्रेकअप हुआ क्या, चालू है क्या, चल रहा है यार. And if you are able to emotionally connect with children, aggression goes down. And lastly, Akanksha, thanks for your indulgence. घर में एक सॉफ्टवेयर बच्चों में है क्या सॉफ्टवेयर? I can share my bad news early. फेल हुआ तो जाके बता सकता हूँ, मार्क्स में गोची हुआ तो बता सकता हूँ, छोकरा छोकरी छोड़ दिया तो बता सकता हूँ, स्कूल में लफड़ा हुआ कॉलेज बिंदास बता सकता हूँ. And this software should be inducted very early in life. And I can share a small story, personal story, and then I will stop. Akanksha, I'm sorry.
No, sir.
एक बार एक बच्चे ने, मेरा बेटा ने, मैथ्स का बारे में, maths, and I was great in maths, 100 out of 100 all throughout my life. I don't know why I entered MBBS. I wanted to become a scientist. So this boy of mine, I said, beta maths का टेस्ट हुआ था, क्या हुआ? नहीं बेटा, डैडी वो टीचर एब्सेंट थी, ऐसा उन्होंने कहा. डॉक्टर वाणी, she said teacher is absent. Milan also, Hemant. अगले दिन नहीं वो शी इज नॉट वेल डैडी, तो क्यों हैरान करते हो. एक हफ्ते के बाद पूछा, टीचर हॉस्पिटल में है, और 2 दिन के बाद बोलते गई. मैं फिर उसके बैग में से वो उसके मार्कशीट निकाला, 8 out of 80 था. उस दिन से मैंने कहा जो भी होता है ना बिंदास आके बोलने का, because I follow one dictum: if a child is in distress or in trouble, hug him a little longer and a little stronger. We don't accept the behavior. But we accept the child and attempt to change the behavior. My dear friends, for having this sharing bad news early, doctors should share bad news early in their families. अरे क्या साला आज वो मैंने आर्टरी काट दिया यार. I'm supposed to, in the hysterectomy, I really cut that artery, or my God, I missed that SOL in the brain which I wanted to watch. And all of us have had accidents in our work. Who's perfect? How many of you had perfect diagnosis all throughout? And when parents share bad news early, बच्चे को लगता है ये अपना जैसा ही है बापू, माँ भी अपनी जैसी है. So I think these are the small things you need to do. But if still aggression remains, Mandolika Badshah, psychiatrist, please go and find out if he or she is able to look at something very different. And I think that is so important. Thank you, Akanksha, for your indulgence.
Thank you, sir. And very, very practical thing, sir, that you mentioned, that yes, having that safe space for the child to be able to talk to us. Until unless we are able to accept our mistakes to them, unko wo comforting zone nahi milega. And in fact, sir, about the doing household chores, sir, my son is just 3 years old, but he still makes sure that once he's played with a toy, he puts it back first and only then gets the other toy out. So yes, definitely, sir, I am following your
Akanksha,
practical
one
advice.
small point could I
Yes,
just
ma'am.
say about teenage aggression. One thing we forget nowadays is about the gender identity problem which the teenagers are facing. And that also could be one of the very, very, very important points in your child's life. Just because you're a doctor does not keep your child immune from having these kind of problems. In fact, I feel children feel more tense to talk about their parents who are doctors about gender identity. And that has become one of the main sources of intense trauma to these children. And we as doctors ourselves have not accepted this gender identity issue. We ourselves are unaware of the LGBTQIA+. I am sure even though we here right now, we have about 284 attendees. And I would really like to have a vote, from everybody who knows about all this. And very, very few physicians we know about this, and we should be open to talking to our children about this as well. I'm not saying that start with a dialogue about gender identity, but yes, if your child is going into a shell, if your child is being aggressive, if your child is doing something which you've tried everything, nothing is working, and like Harishana said, one of the most important things is about nutritional deficiency. We should not always jump onto some psychiatric illness. We should first try to find out the physical deficiencies as well. And definitely talk to your adolescent children about gender identity. I would not ever leave that out of my conversations with my children. So I want the physicians here to start talking even to their patients, the pediatricians or the gynecologists who are dealing with that age group, to start talking to children more openly about these issues as well.
Nilima, I would like to add to this. One is gender identity, but as a percentage, I have to just share that in Cooper, we are a referral center for a lot of children who are undergoing sexual abuse. And you will be shocked that just in Cooper, which is a standalone hospital, we have got reported cases of more than 1,500 in the past 4 years. And these are just reported cases, of which almost 30% were below the age of 18. And a lot of times people have come very late. In fact, recently one of my registrars has gone to interior of Maharashtra to answer the court summons of a 12-year-old girl who came with a pregnancy. And there are so many such cases. So in adolescence, sometimes the issue of good touch, bad touch, sexuality and abuse is something which they don't know who to talk to, and they don't know about it. And although we think that the internet and media gives everyone exposure, these are a lot of issues which are not coming to the surface. So as parents, we have to start having a little bit of those conversations also, and with our patients with unusual presentation. Like we had a 9-year-old referred with some skin lesion from skin OPD, herpes. Now, why would she get herpes? Then the conversation went into possible sexual assault and abuse, which the girl also didn't understand, that there was something which was unusual which was happening. So I think these are also important issues which affect their mental health and can lead to long-term consequences in their interactions in adult life. So I think this is also one thing which is often not talked about, which we need to address.
Absolutely. So reaching to the root cause of the reason behind their age, identifying any physical illnesses or identifying sexual traumas or identifying any sexual orientation, which is different. That takes us to the next
Akanksha,
Yes.
one small point again, please. As a gynecologist, we get children who come to us and talk to us about all this. I make it a point, even if it's a child, I make it a point to send the parents outside the consultation room when I want to talk about it, because children don't open up in front of their parents, and people are scared even to talk in front of the mothers because they see that the husband and wife are together. So if I tell my mother, and if the father is the abuser, or some uncle is the abuser, the child feels frightened to talk in front of their parents also. So I do send the parents outside for some time and then talk to the child. Is there anything, something which you want to tell me, which you're not comfortable talking about in front of your relatives who have accompanied you? Then please be open and please tell me everything. I am there to help you. And whatever you tell me shall remain between you and me, is what I always tell these children who come to us. Thank you.
That's very important, ma'am, because even I've encountered two cases where the child had actually opened up to the mother and reported what was going on with her. But the mother had, instead of taking the required steps, the mother had in fact shouted at her, and she had beaten her up in one instance where she was told to not report this to anyone else and that it was her fault. And the child was made to feel very, very guilty about going through that suffering. So I think what
That's
ma'am said
exactly why we
is
keep the
very
mothers
important.
also out at that time,
Yes,
with the mothers
yes.
trying to protect the husband. We have seen that so
Absolutely.
often.
Absolutely, that's very important. Thank you, ma'am. I can see the next question has been coming up a couple of times. In the last 2 years of COVID, and the practice has
Just a
always
moment,
been.
Akansha. Just two
Yes,
things
yes,
that
doctor.
we can just, I'd like to add just there about one. When we're talking about adolescent aggression, we all discuss all these various issues, and each of them can manifest as adolescent aggression, right? That's something that we need to remember, whether it's gender dysphoria, whether it's history of sexual assault, trauma, all of those could manifest as adolescent aggression. And we know very well that as psychiatrists, we know that adolescents tend to manifest outwards. So aggression is their way of expressing very deep and intense emotions. So then that's something that we need to take into account. To just take from what Harishan was saying, we look at we as parents need to become those children, because we need to know the stuff they're doing, what they're doing. क्या नया चल रहा है, ये बहुत जरूरी है जानना, है ना? We need to be in sync with what's happening. What are the new video games that they're playing? What do they enjoy? What are their groups playing? Whether your child talks to you about it or not, it's good to bring those things up. When your child knows that the father knows what's happening in the world around and knows what other children are doing, then he or she definitely has that safe space to say, okay, isko pata hai kya chal raha hai. He knows what the peer pressures are. He knows that people are going to pressurize me into playing the games that everybody's playing. So all of that, once we're able to connect on that level, I think it makes things much easier to sort of get through to children.
Absolutely, sir.
Sorry, we're all excited to talk. Just 2 lines. Stressed parents become authoritative. Relaxed parents are able to. Number 2, 20 years back, I would say trust your child completely. But now I say trust your child completely, but keep your eyes open. Number 3, I read about all music videos. I've learned about BTS, Blackpink, Taylor Swift. I learned about it. Without that, I can't have a conversation with kids. And I learned about all the games, video games. I ask my kids about all movies so that I can have a rapport with the kids. So these 3 things are also very important. Thank you. Sorry, Akansha.
Absolutely. Incorporating.
Akanksha, we need to steer it back to the physician's
Yes.
happiness part. That is
Yes,
our
ma'am,
main goal.
going there. It's important to incorporate our life into the children's life and understand what they are going through, and then they will have that safe space to talk, and that will help with the rage issues. Moving forward to the next question, this has been a recurring theme. In the last 2.5 years of COVID, practice has come down, and a lot of doctors have asked this: how to manage the finances, and how does that have a role to play when it comes to being happy and peaceful? Can I request Dr. Milan to take up the question?
No, very personal perspective, I think COVID has been a blessing in disguise, because prior to COVID, I was working 9 to say almost 8. And the only time I saw my child was when I dropped him to the bus stop. When COVID happened and then we spent much more time together, I realized that if I don't change now, I'm going to miss this childhood. So I think that's with regards to this very specific question about finance, I'm definitely not the expert there, but let's put it this way, that COVID has brought its, of course, difficulties. We've had people losing people who are very close to them. There's a lot of distress that has come from that. We've gone through a lot of anxiety. Yes, we've for long periods not worked as much as we've worked before. But the whole, I think the whole issue with finance is also very emotional issue. There's a lot of connections that we have between finance and emotions, and we know now that a lot of doctors are very heavily into equity stocks, and you have most of the discussion happening around those things, and people's emotions seem to swing with the stock markets. So I think we need to reassess that we can't link our emotions to our finances constantly, because that's going to definitely have a serious impact on us. And again, the questions are about how much, why, what we need it for. Does it bring us joy, or are we looking for pleasure? Like Harish Anna was saying, that there's a huge difference between what is joy and pleasure. If you're chasing pleasure only, and that's what those finances are for, then we're probably looking in the wrong place.
And I think the corollary to this would be, just apart from the financial burden as well, there have been a lot of stressful events, and we go through professional stresses on the professional front, on the personal front, illness of the family members, loss of a loved one. So I think dealing with all of the other stresses that are coming and how to cope with them and move ahead. Dr. Harish Shetty, sir, can I request your inputs on this?
Yes. I would again go back into finance, 3 areas. One is, years ago, family physicians started saying that the practice has dropped because most of them go to consultants, and the middle class family physician had a big crisis. I'm talking about the MBBS doctors. Others have great practice. Now, what we did at that time is we asked them to actually start treating psychiatric patients. Now, when I say GPs and non-psychiatric physicians should treat psychiatric patients all over the world, family physicians treat. So we started training family physicians to treat simple depression, not complicated by suicide, not complicated by bipolar, not complicated by substance abuse, and not complicated by strong family history. And then when they started using antidepressants in a dose which is appropriate, a lot of family physicians said, "Hamara practice increase ho gaya, because 1/3 of patients are because of anxiety and depression." We started practicing. That is one side of the story. The second side of the story is that a lot of consultants suddenly, especially the surgeons, suddenly found that their OTs are empty, they have very less practice. I've seen that happening. And a lot of doctors have phoned me up and said that itna kam hua hai. And then that's the time to understand that what's happening with your thoughts, your feelings, your sensations, and what exactly happens. Well, there are, how will you go and share it with your family? If there's a male consultant who has to go back to his family and says, "Abhi is baar ka international trip bada mushkil hai. I don't think I have the money," or probably we were trying to buy a car, but this time car. So there are four types of sharing when you have a financial problem, because ultimately life revolves and improves when you put the feelings on the table and accept the situation. And you don't accept the situation when your mind is locked. So what are the things? Number one, anxious sharing. अरे यार अभी बहुत प्रॉब्लम है यार, अभी कुछ नहीं होने वाला. The second is neutral sharing. Practice कम हुआ है. This is the truth. And the third is angry sharing. अभी वो अगला फ्लाइट नहीं लेना, अभी गाड़ी बाड़ी अभी नहीं, एंड अगला एक दो साल हम कहीं नहीं जाएंगे. But there is empowered sharing also, where the doctor goes and says, "Yeah, come here, practice. I would want to share it with the entire family, and this is where it is. We'll find out how we can work through this." Empowered sharing इतना आसान नहीं है, and it so happens that to get that person to share in an empowered manner, he should sit down with somebody like Akanksha or Milan and put the feelings on the table. What are the automatic thoughts? अरे लोग क्या कहेंगे? अरे यार मैं if I walk outside OPD up and down because I have no OT, what will the others say? That's a very big thing in a feudal hierarchical world in India. And there are many automatic thoughts. Putting down the automatic thoughts and automatic feelings, then telling, let's go and tell the family, this is what it is. And when you have, this is what it is, I think my practice is less. I'll try to really build my practice and see exactly what happens. The family comes with you. They don't criticize you. They don't insult you when things happen. The third point is helpfulness and helplessness. These are two words which are very important. I'm going to pen an article on this in the next few days. Well, there are people who help everybody else, like Nilima, Reena, Akanksha, Milan, helps consultants. Dr. Kapoor helps consultants, gives all advices, and they're fantastic. But these guys who help everybody else are also helpless at sometimes. And these guys who help everybody else are not able to seek help, and that is a very big issue. So the next point I would say is, whenever you are down, yaar, 4 doston ko ikhatta karo. And not those friends who give you long pravachans, friends who share. And 4 doston ko ikhatta karo, shaam ko baitho yaar. And when you sit down with 4 brains together, you find that the new things come up. So you have a support group which accepts you exactly as he or she is, and then new ideas come up. Lastly, practice will go up and down. The world is changing. In the big hospitals, they get TPA indemnity faster than in small hospitals. And then there's a lot of changes happening in practice. But are you prepared to innovate? I ask all consultants, how many of you are prepared to sit down at the end of the day, last patient, call 5 patients of diabetes and have a support group meeting, helping them understand different aspects of diet? How many of you will sit down with those women who are infertile and not able to really give birth to a child, and sit down and form a support group and chat? And if you do that, remember, the word spreads. This doctor is not only a scalpel doctor. This doctor is not only a Golika doctor, a Maraka doctor. This doctor sits down and understands our problems differently. When I started my first support group for patients suffering from schizophrenia, what they talked in the clinic was medicines and symptoms. What they talked in the support group was life. So if you actually deal with life, your practice comes back. Again, Akanksha, you're very kind. Lastly, one day, a bunch of consultants asked me, "Kaisa practice badhane ka?" I said, and they said that they are in a corporate hospital. The marketing guys are not doing anything. I told them, marketing guys will do their job. You have to do your job. Hospital will grow with the consultant. Consultant will grow with the hospital. But there's a second trajectory. Hospital will grow in spite of the consultant. Consultant will grow in spite of the hospital. Who stopped you? It was a surgeon. Who stopped you from going to the nearby schools, giving you a card and say, I am prepared to talk about how food is absorbed in the intestine in a manner which is very interesting. I will not talk about appendicitis. And understand, help them understand with the multimedia presentation how the small food particles breaks down and slowly it goes. Who stopped the ENT surgeon from showing the beautiful hair inside the nose and what it does when you breathe? Who stopped consultants from educating people? Practice grows. When you go to the community, you don't have to depend on anybody for your practice. So be innovative. Be there. Find ways, and you can only innovate when you're relaxed. As Dr. Akanksha said, those two things which she said is so important: gratitude and a positive experience. And if you're relaxed, your brain innovates. If you're stressed, your brain stops. So I think there is no excuse for a doctor. You need to find innovative ways to change your practice, to accelerate practice, and remember, kill shame, seek help.
Thank you. Can I request Dr. Nilima to please add on a few?
See, you talked about COVID and how COVID has destroyed our practices and all that. But look at the positives and all negatives. You know, COVID gave you time for yourself, time to be with yourself, to introspect, to understand what your priorities were, to understand what really makes you happy, what really makes you unhappy. It was a golden opportunity for all of us to know our other strengths than being just a doctor. I also would think that Harish and I told you very beautifully as to how you can be innovative, how you can be an entrepreneur, you know, knowing your strengths and your weaknesses. But right now, when you are in that low phase, when your practice has gone down, also I would advise you that you have to tide through that phase as well. So practice minimalism. Minimalism does not mean being conjuice. Minimalism means knowing your wants and knowing your needs, and first prioritize your wants and not your needs and not your wants. Your needs are your basic things. जितनी चद्दर उतने ही पैर फैलाना बहुत जरूरी है. Satiety center को आपको थोड़ा सा नीचे लाना बहुत जरूरी है. And live within your means is what you should start doing right away. And then, yes, work on your strengths. Try innovative things, try entrepreneurships. Just because you're a doctor does not mean that you can't do something else. You have so many skills. You're such an intelligent person. A doctor, you have just developed being a physician, being a healthcare professional. But that does not stop you from being a singer, a dancer, a cook, a good thing. You are so beautiful. You're so varied and you're so talented. Tap into your talents. Today, the world is such a small place. I mean, anything you want, you just need a market for it. So to get finances is not very difficult. Do not consider your profession only to be your source of income. You have become a doctor to be a healer. Please understand that you have not come here to earn money. That is not your basic focus. आप अपना काम करते रहो, पैसा आपके पीछे पीछे आता रहेगा. लेकिन ये सोचना बंद कर दो कि my practice has gone down. Whatever number of patients you have, you treat them well, give them good amount of time, make them satisfied, and believe me, word of mouth is the only way that you are going to get more practice and more satisfied patients. And the more satisfied patients that you have, the more satisfied you will become. So you start financing your own satisfaction. You know, if you understand, make your wealth also healthy by thinking about it in this possible way. कम कितना है वो मत देखो. You know, we always talk about the glass half full, but you talk about the half full part of it. You know, don't talk about the empty part of it. What you have, you develop on that. Thank you.
Absolutely. Very optimistic inputs, ma'am. And Dr. Vani, may I request you to please share your experience?
So to just carry on with what Dr. Nilima said, last weekend we had a wonderful panel on FinCon, which is there on our AMC website, where we talked about how doctors can optimize their practice and grow their finances within their limitations. And I would really request all the consultants who have the time to go to the website and look at our the important messages. And what was talked about in COVID, there was a bit of collateral damage, but there was a lot of learning experiences also. Particularly, I would like to highlight the problems of resident doctors and those who have become consultants and got their degree of MS and MD, where actually for their branch, they have not learned enough, but have learned only COVID-related management. So these are also issues for our younger generation of doctors who have to move on and evolve and learn how to deal with it. So I think we as consultants need to look at these aspects also when we are talking about the fallout of COVID. It's not just the disease, it is the social and the emotional and the work related fallout which we need to deal with within our own specialties. That's just what I wanted to add.
Absolutely. In fact, COVID has not changed just one aspect of our life. It's changed the entire lifestyle. Post that, we've become very different on how we look at health and profession and personal life. So yes, summing up, we have spoken about being optimistic and looking at the positive side, finding our ways and time, using our time to do something more productive, following our hobbies. Just one more thing that I would like to add here is, because COVID has now given us the time that our practices have come down a little and we have slightly more time on our hands, why not take it up to do one bothersome activity every day? So something, it sounds very counterproductive, but basically what it means is that there are things in our life which we keep putting off. Okay, I'll start that SIP once I have more time, or maybe I'll read up that book when I have a little more time. Why not use our time now and start doing those things? One activity per day, even that will give a big change. Can I request Dr. Duggad sir for his inputs, please?
Harish, question for you. When we are talking about the happiness of doctors, and we, so smoothly, nobody understood, but just we changed to the finance and practice and money. So now the question for you to answer is, how much is sufficient or how much is not sufficient?
Hemant, you really put me in a spot, but I'll try, and I'm sure others would have their own answers. When I started my practice, many of my friends had cars, and I had a bike, 100cc Kawasaki bike. One day I had to see a friend's father who was hospitalized at Hinduja, and I took my bike and parked in the place where car has to be parked. The security guy said, "यहाँ आपका गाड़ी नहीं park कर सकते हैं, यहाँ सिर्फ car park होता है." And then I said, ये हमारा car है. And I said, nothing doing, I will park here. And I insisted, and I did not yield, and I went up. When you feel that what you have is respectful, nothing affects you. That's number one. Respect your environment, respect what you have. You don't feel that you have less. Though occasionally you might feel, अरे यार, वो साला Mercedes में गया, वैसे ही गाड़ी होता तो अपना क्या होता? Occasionally you will get that feeling. But the point is, respect your environment. And also for all the spouses of doctors who sometimes say, "तू मुंबईत येऊन काय झक मारली? तुझा मित्र बघ आता 3 हॉस्पिटलचा मालिक आहे." There are many. And the point is, when you start respecting your 165-liter fridge or your 2-bedroom hall or your 1-bedroom hall initially, which probably becomes much bigger after you grow, is something which is very important. Also, respect your children, respect your spouse, which is also very important. And they're not perfect at all. None of them are really perfect. The day when you start doing that, that's the time how much you need is a unique choice which each one of us makes. And that I think is very important. Now, let's look at full-timers and private practitioners. A lot of full-timers cry and say, हमारा 30% कट जाता है वो salary, वो कभी वो February or March में हाथ में कुछ मिलता नहीं. And my friend full-timers say, यार, I was brighter than him, but साला देख वो अभी practice करके, I should have been a practitioner. A lot of judges come and say that his friends who are lawyers are doing much better. So in between वो thought आता है. But the point is, fiscal hygiene and philosophy of money is extremely important for us to have. And nobody, everybody is unique and everybody's needs are very unique. But the day you look on the side and say, you have got less, you have lost it. Milkha Singh did that mistake, no? He looked on the side and came fourth. He would have stood first. And I think that is very important. But some people are driven, they're driven. They have 7 hospitals and they manage them beautifully. It's good for them. It's good for them and nothing wrong. But I still see a lot of consultants come and actually tell me, यार मेरा friend USA गया, तभी मेरे को chance था, मैं बिल्कुल गया नहीं, यार मुझे आज बहुत खराब लगता है. In between thoughts आए तो बिल्कुल ठीक है. But the day you say, what Om Puri said to his wife, and his wife shares that with me, मुझे सोने की चपाती नहीं चाहिए, मुझे चांदी की भाजी नहीं चाहिए, अपने को कितना चाहिए वो ठीक है, but I don't think that all of us are monks. You need businessmen in the community, you need farmers, you need different people. So I think your own unique philosophy develops across time, and then you are there, and they say that this is what it is. And also very important is एक दिन में तुम कितना पेशेंट देख सकते हैं और कितना आप देखोगे. मैं तो लेफ्ट हाफ ऑफ हॉकी हूँ, सेंटर हाफ या लेफ्ट हाफ. Who passes the ball? I send patients to different psychiatrists across time. I send patients to different psychologists across time. I don't want to treat everybody. I can see a fixed number of clients per day, and that is enough for me. That's my personal philosophy. But I think Hemant, हर एक का need, हर एक का भूख, और कभी-कभी हर एक का greed, ये बहुत ज्यादा होता है. But the day when you feel extremely insecure that यार अपने को कम है, उसको ज्यादा खलास, and the day when you see your junior who was assisting you starting a hospital exactly opposite yours, and you feel so angry, that time also खलास. So सोने की चपाती और चांदी की भाजी जैसा ओमपुरी ने कहा, वो हमें बिल्कुल नहीं चाहिए. And I think ultimately we are temporary travelers on the earth, as Osho said. And that's sort of a philosophy we need to. But you know what, Hemant, lastly, Akanksha, a lot of us have needs. We have to send our kids to private colleges, and you need that money to pay at private colleges. And that is a real dilemma. And there you start asking existential questions. I should have been in practice. I should not have been full time, etc., etc. But I think you need to find harmony between the needs and what you need to do, and I think it's a personal philosophy which evolves across time, and we need to develop. As far as I'm concerned, I'm very comfortable with my fish fry, a little rice, little curry, and a little ice cream. I'm so happy. I'm okay with the car which is small, and I'm perfectly comfortable about it. Absolutely comfortable about it. I don't feel the need to buy a very big car and put all my money there. I would rather give it away in charity and to an NGO. So that is my philosophy. It depends. But we need all types to make the world, Hemant. It takes all types to make the world.
So the cause is comparison, or cause of unhappiness is your higher expectation. What would you say that what is
more into a Jugalbandi with Hemant now, but I would ask everybody to reflect and answer. But I think it's the day when we feel unhappy because somebody has something more, you're gone. Because there is no end to that at all. Like, for example, somebody wants to become something in IMA, then he or she wants to become the state. Nothing wrong in that. Perfectly wrong, because we need good leaders in IMA. But the day when he feels I have to work for the betterment of doctors, and I'm okay if I lose the election, and it's perfectly all right, then you are at peace. But you feel nahin abhi isko kaisa bhi apun harayega, maa kasam bolta hai chhodega nahi. And then you know what, Akanksha, we have not touched this important issue. Hate is a disease in the modern world. Loneliness is a disease in the modern world. The day when your heart has a lot of resentments, a lot of hostility, a lot of hate, and that's the time when you have lost. But if you want to say, I want to improvise, I want to really make 3 hospitals, I want to make 4 so that I can work with the poor as well as rich, and I can manage both, I can delegate, I'm a good leader, I can appoint other doctors, perfectly all right. So if you're aware, and ultimately we need to touch, Akanksha, about the awareness within, and what hate is doing in the world, and what actually hate is a disease, and loneliness is also a big disease in this modern world. So if you look around and say, iska jaisa aapko apne ko banne ka, maybe it might affect you, but I want to become a better version of myself. That I think would be really, really fantastic. Sorry, guys, this Hemant has this habit of pulling my leg and provoking me. He's my very old friend. We have started practice together at Andheri.
Together. Same batch, 84, MD. So, but then this is what I wanted you to dwell upon, that when we are talking today as pursuit of happiness, the angles or the aspects which are governing all this, and the simple solutions to that, which can be taken within to get that happiness. I mean, the purpose of today's webinar is that. That is the reason I purposely asked you that question.
And I would request each one of you to see the film in Pursuit of Happiness. It's a beautiful movie.
I think it's just the difference between sir need and want. वो जहाँ पे difference आ जाता है, I need this versus I want this. That is something that comes in between us and the happiness. True. I think Dr. Vani and Dr. Nilima have certain inputs.
So Max Ulrich, a German philosopher, way back in 1827, wrote this beautiful poem, Desiderata. And I would urge all of you to go to the website and see it. But it has a very nice line, that go placidly in the noise and haste, and remember what peace there may be in silence. Do not compare yourself with others, because there will be always lesser and greater people than you, and it will make you either vain or bitter. Bottom line, what it's trying to say is that have your own boundaries and decide that what you're doing. And as Dr. Harish pointed out very well, compare your own self with yourself and see how you can evolve as a person. And as I think one of the only Pakka full-timers on this panel right now, a lot of people told me that, Vani madam, you would have earned 5 times as much if you were in private practice. Why have you not started practice? But that is a choice which I have made. And then if I see that, oh, my room is not very good, if I go to one of my private consultant friends and see how beautiful their hospital is and their room is, but how much more time and effort they are putting in, there are pros and cons. So what I feel is, once you make a choice and you have made that choice consciously, be happy with it. No choice is perfect. There are always some pros and cons of your choice. But if you have made that choice consciously, live with the choice. Unless you feel that now it is bothering you, then change it. Otherwise, I think that is what will be the inner core of getting yourself to be happy with the choice you have made in your life. Over to you, Nilima.
I think all of you have put in such beautiful points. मेरा एक छोटा सा इसमें input ये है कि finally what you earn and what your happiness is revolves around your family. You are not a single person. Please understand you're part of the family. So what you need to earn is for the family unit. Your happiness also is from these near and dear ones who are there with you day in, day out. So if you say that I don't want to earn and I don't want to do this, but your children have ambitions, you need to do it for them because you have given birth to them without their permission. It has been your choice. So what you need to provide for them also is your responsibility. So you cannot possibly say that I will not do this and I will not do that. Once you are in a family unit, you have to work as a team and the input has to be there from the entire family. So the family needs to sit down together, decide what their needs, wants, and ambitions are. Where my family is concerned, my children were very clear that they do not want to go to any of the colleges by paying capitation fees and all that. Maybe those are the values I had instilled in them. And that is why they were very sure that they do not want me to earn that extra crore to pay into a medical college and all. And they said they are going to go to the colleges on their merit where I will not have to pay too much. But there are children whose ambitions are different. So you may have to contribute to that. So sit down as a family unit and decide what your wants actually are and work towards it. But there has to be a time in life when that comes to an end. Where your children are concerned, giving them a good education is your responsibility. But after that, education loans for higher education loans are available. To set up their business may not be your responsibility. Make them responsible enough for their future. And that is your job as a parent. And then the remaining finances are there for you, for your old age. Never ever forget that you are responsible for your finances till your death. You cannot depend on someone else. So the happiness also depends on how you can provide for yourself every day for your wants. Needs and greeds are something which we do not know. It's a very personal thing. So consider your family unit and their happiness when you are trying to set up your goals initially, only when you start practice, as to how you want to establish your practice and scale up, and where you want to give up that active earning and only live on your passive earning. So like Dr. Reena had said, we have FinCons planned for you, where we are teaching you to utilize the money that you have already earned and build on it. Thank you.
Thank you, Dr. Reena Vani ma'am and Dr. Nilima Bhamte ma'am. Those are very relevant inputs, actually. Being a social animal, our happiness is never just our alone. It is linked with the happiness of our family, friends, and colleagues around us. That's very relevant. I think we will take up some more questions. We're talking about burnout and doctors' wellness. I think a very relevant question that has come up is how to identify that we are actually getting burnt out, how to identify those emotional symptoms or those physical symptoms, sleep disturbances, appetite changes, what is happening within us. Dr. Milan, sir, can I request you to take the question, please?
Right at the beginning, Harish sir spoke about how you start procrastinating or pushing things. You say, I don't, आज Monday को उठ के मुझे surgery करने की इच्छा नहीं है, is definitely worrisome, right? Otherwise, surgeons are always gung-ho about surgery. So when you start having those kind of feelings, of course, sleep, appetite issues, no energy, not enjoying things any longer, losing interest in practice as a whole, starting to get very irritable or upset with things around you, with patients, with family. When you find that's all sort of building up, it's not only burnout, it may be going, and we also need to know that depression is like on a continuing with burnout. So like when things get worse from there, no sleep, no energy, people tend to also, for example, we spoke about this whole thing about how doctors are very reluctant patients. They will try to avoid meeting someone as much as possible. They believe they want to fix themselves. We are all so individual and ambitious and driven that we feel, no, we should be able to fix ourselves. All of that does add to the problem, and then it can sort of reach a stage where you can see full-blown symptoms of depression, no interest, no energy, passive death wishes, even suicidal thoughts. All of those also may come into the picture. So this is like the depression, like the burnout depression continuum in that sense. When we find these symptoms are more, so we also talk about a lot of anxiety, palpitations, restlessness, always feeling on the edge, always feeling nervous, that kind of scenario. When we see all these symptoms, definitely we're talking about more severe burnout and bordering on depression.
Dr. Shetty, sir, can I request you to please add on to this?
I think he said it all, but also what is very important is to really differentiate burnout from depression. You are not happy to do things which you really enjoyed, and if you see the sequence of burnout and how it progresses, you actually see a lifestyle and then symptoms, and sometimes it's very difficult to differentiate between burnout and depression. And if you cannot differentiate, err on the side of the person having depression. Irritability at home is also a very important symptom, and very irritable with patients is also a very important symptom. And energy, or lack of energy, as I said, and actually a doctor identifies it, but he does nothing about it. That's the big thing here. But you see, Akanksha, there are different types of personalities also. Can you ask our Prime Minister, are you burnt out? You can never. And I still remember that interview which he gave. And he said that somebody asked him, how do you relax? And he said, when I enjoy my work and I can really do my work well, I feel very relaxed. Now, can anybody be like him, sleep for 6 hours? But you know what he does? He does 2 hours of yoga and also exercise after that. But he's able to do it. Can all of us actually do it? No. So we're all very different in our needs. And what is very important for us to know is what is it that is a balance between work and life, and what is it that we need to actually do. So depending upon our drive, say for example, a great leader from Maharashtra whom I met at the time of the earthquake 93, he's almost 80 today. He sleeps for 4 hours and is able to work for 16 hours. So different natures, different personalities, different people are different. Let's not imitate the other. So somebody said, he works for 15 hours, he's still fresh in the evening and he's good in his family and he still is doing wonderfully work. You may not be able to do it. So understand that the threshold of functioning is different for different people, and that's where we stand. What do you think, Akanksha, about burnout?
Thank you, sir. I mean, definitely there are multiple symptoms that we need to identify. But as Dr. Milan sir and Dr. Harish Shetty sir described, that there are emotional symptoms, physical symptoms, and cognitive symptoms. Emotional symptoms in the sense of low mood and inertia and not feeling like going to work. Cognitive symptoms where there is attention deficit, where there's forgetfulness coming in. Physical symptoms in the form of sleep, appetite changes, fatigue in the body. But I think what we need to differentiate is the change from our daily patterns. We all can get sad at a time. We all can feel like not going to work at some point in time. But understanding when that change becomes persistent and it starts affecting our daily routine is
that's the point.
We should make that distinction that the burnout is creeping in.
Absolutely.
So, yes. There are also a couple of questions coming in on how is physical exercise, relevant, and how is physical exercise important to deal with mental fatigue and burnout? Requesting Dr. Harish Shetty sir to please take up.
Well, all of you guys go to the website and type My Black Dog, and you'll find a WHO video on Black Dog. And what is it? It's not Black Dog whiskey. Black Dog was the term Winston Churchill gave for his depression. And World Health Organization has come with an animated movie which says exercise helps depression, mild depression and stress. Endorphins are released, changes in the brain, neurogenesis takes place, BDNF is actually released. And this 4-minute video is a must video for each one of us to watch. So exercise by itself is an antidepressant for those who are mildly depressed and stressed. And remember, there are 3 types of exercise. You know how doctors are, Udyapasun exercise karna. Udyapasun nakki. Even I have stopped since I had COVID in August, and I have to start by today evening, and I will start. So I think exercise has been found to be useful, and there are enough research on that. So and this exercise has to be joyous, and there's different types of exercise. For example, somebody is walking, or somebody is running, or somebody is doing some exercise. There has to be joy, and you can't be very obsessive about exercise. Hey, 5 kilometers, hat ja beech mein se. Don't give me a call when I'm exercising. I've got fever. Tera fever, we'll see later, but I want to exercise. No, that is not exercise. Joyous exercise when you're aware of what is happening in the body. Some people say, I walked up to the clinic, that's 2 kilometers, that's exercise. That's not exercise. When you're aware of what's happening to your muscles, it's exercise. When you keep a tochan in your ears, that is not exercise. Let me tell all this, break this myth. I listen to music and no, focus on the awareness of exercise, and there's no need to keep tochan inside your ears to do anything. Complete awareness in what you're doing, and exercise is a great stress buster. Exercise dissolves fears, tears, and anger, and that I think is extremely important. Exercise also helps people who have sugar, diabetes, not to bring down the sugar, but to improve The coconut here also, there when you feel good and happy. And exercise is a happiness inducer. And each one of us should do exercise. Depends upon what our doctor actually advises. And that is important. There's no need to boast. मैं marathon भागा, मैं ये भागा, मैं आज 10 किलोमीटर. चुप बैठो यार. अपने लिए करो ना. अपने लिए करो. You put pictures. It's all right because you inspire others. Like what ma'am said beautifully. That AMC has used, started a marathon, cyclothon. And I was very happy to hear from Lima. But bikeathon, and I drive bikes. I want to see you on a bullet.
Definitely, sir. आप एक हिम्मत करके मेरे पास पिलियन बैठ जाओ, बस मजा आ जाएगा.
We used to do that long ago when we were younger, and I've loved bikes all my life. So, Akanksha, as you know, and we all know that there is research data, and everybody should see this film. I Love My Black Dog, or I don't know the title, but I think it's about Black Dog, World Health Organization, evidence-based.
I think as doctors, we are all aware that yes, exercise releases the endorphins and exercise is very, very important. I think the implementation part is where we all fall a little short. And Dr. Vani, what has been your experience with exercise and mental health?
So here I would like to say that what Dr. Shetty mentioned, absolutely perfect. And we all know theoretically about the endorphins and other things. But as doctors, are you going to be able to take out the time? And what he also said is that some people tell me, I have done housework, I have walked to the clinic, I have done this, that. That is not exercise. It has to be focused. They say that part of it is just fitting it into your routine. For example, I have a colleague who, if she cannot go to the gym, will not use the stairs and walk up and down the steps of her hospital 4 to 5 times. That becomes exercise which you have incorporated into your routine. My own brother is an orthopedic surgeon, but has more than 5,000 followers on Instagram now because he has lost more than 40 kilos, despite being a busy orthopedic surgeon, and now has a body like Salman Khan, which has been maintained for the last 10 years. It is not a flash in the pan. And along with fixing bones, he gives advice on fitness to people because it's his passion. So if you want to do something, you will find the time, and you have to do it because you believe in yourself. Of course, for me, I cannot match what my sibling has done, but I try to, despite having postmenopausal issues and a bit of osteoarthritis, I have joined an exercise dance class because I enjoy dancing. And I go there and I do whatever I can 2 to 3 days a week. It is not that you are too busy. You have to find the time and do what you can do. And I think to set an example to your patients, I cannot tell my patient, तुम व्यायाम करो, तुम fried मत खाओ, तुम sweet मत खाओ, unless I walk the talk. Then you will be able to convince your patient accordingly. So I think that is also very important for us as doctors to understand that we have to do it for ourselves and find the time. And I'm sure each of the people here, if you really want to do it, you will find that half an hour, 3 days a week to do it for your own self.
It's all about priorities. Once you decide that this is a priority, you will find time, come hell or high water.
Absolutely. And I think this resonates entirely with what Dr. Harish Shetty sir said right at the beginning, that all that we are discussing today applies to us as well as much as to everyone present here. I think there is a last question that I would like to take.
1 minute. I'd like to just add a bit. I think the biggest problem with us is because we work in a profession where stakes are high, obsessiveness and perfectionism are things that we are stuck with all the time, right? So that's one of the big problems also with starting exercising. Exercise ये वाला करना है कि वो वाला करना है, zumba करना है कि yoga करना है, उसमें आधी जिंदगी निकल जाती है in deciding what's right for us or what we should do. So like Shetty sir said, I think it's not important what you do, but if you're going to enjoy it and if you're going to do it joyously, it's definitely going to benefit you. So if you're going to do something that's forced and you have no interest in it, and then say, "Aure maine exercise kiya par endorphin kahan gaya?" Then it's not going to happen.
Absolutely. So there are a few questions posted about patients being irritable, and I think it is a common experience that we all must have had at some point in life where you a patient walks out of the cabin and they're very irritable and loud in the waiting room and are disturbing everyone else, complaining. And I think there's also a question mentioned about how as doctors we cannot always have a perfect diagnosis and perfect treatment. We might inadvertently make some flaw, or might forget something, or might not realize what we are missing out. That guilt stays on for a long time. It can be a reason for the burnout. I would invite everyone on the panel to please come forward and share your personal experiences on both of these issues, starting with Dr. Harish Shetty, sir. Could you please enlighten us on this?
I think the world is getting irritable. Anger is the predominant emotion. There are irate parents who trouble schools. There are irate patients who trouble hospitals. In a big corporate hospital, it gets handled very easily because there are systems, but in private practice, very difficult. I think 2 or 3 things which can really minimize it but cannot exclude it. Number one is that have group practice. Now, in my prescription, Milan may have observed that there are names of at least 4 psychiatrists and the numbers. Jana hai, aapko nahi acha lage, aap ja sakte hain. Now I'm going to put 20 across the city and in every suburb. So they have a choice, and we don't actually want them to come if they don't like us. That's number one. Number 2 is support group of doctors. Like we have had this coffee hopping club among us. in COVID, it stopped. So Bharat Shah, Anjali Chabria, me, sometimes Yusuf Machiswala, and sometimes Hinal Shah, we sit and talk about the impact of all these things which happen to us. And irate patient can destroy your sleep without any reason. It's not that we are wrong, and can destroy your mood across time. But what happens among doctors is doctors don't share it. They keep quiet. They don't talk about it. And so support groups are very important among your friends. And that really brings things down. Number 2 is that have enough staff in your clinic to handle irate patients. I mean, the staff have to be strong enough to handle irate patients, and tell them, Baba, I cannot handle you and you can be. Number 3 is extremely important for all specialties, gynecologists, physicians, to have a psychologist in your team. In fact, Dr. Shankar, the headache specialist, actually got one, and I sent him one, and she worked for a long time. Everybody should have a counseling manager to talk to patients before you meet them or after you meet them, and things actually largely calm down and things get managed. It's a team which will work, and it's not you alone. So I have at least 2 psychiatrists and 3 psychologists in my clinic who work with me. So that also calms down. When they see a different phase, anger actually goes down. Keep the centrifugal force on when you feel that somebody is not happy with you. And hey, I don't think I'll be able to work with you. There are many others, and these are the names you can actually go to. Also, don't give appointments to a point that you can't handle. And if you have, say, 18 surgeries, which is actually lined, and you feel like doing only 10, pass the 8 to younger consultants or other consultants. So I think a team, number of appointments, support groups, and what is very important, there are pathological guys who are irate. Pathological, they do it with everybody. And there you have to be very firm, very, very firm. See to it that you treat all the patients, all the people around your clinical, you work with law enforcing agencies, and have a connection with them to see that they respond to you. There are groups across the city where they have groups of doctors who rush to the help of the other immediately. So team, support group, don't take too many clients, and a team inside your clinic will bring it down. But you cannot avoid the anger among all the patients. Then if things go wrong and things go haywire, it's good to go and sit down on a night with a cup of coffee, and share it with your neighbors. Being vulnerable emotionally with your colleagues will help you to manage all the impact of these patients, and that I think is very, very important. There is no God's gift to the human race. In your clinics, you are closer to the patients. In corporate hospitals, you are distant. So that is the difference. This is going to increase in the times to come because the world is changing. The world is getting angry for multiple reasons, and teachers and doctors are the softest targets.
Absolutely, very useful insights there, sir. Thank you. Dr. Hina Pani, ma'am, can I request you for your insights on the matter?
Yeah.
Irate patients are not just in private practice, it is also in public hospital. What Harish Khanna said limits the number. Now, that is just not possible in a public hospital. Still, you will have people who are coming to the public hospital who have expectations of 5-star treatment at what you would say as third world prices or free treatment. Even then, it is a challenge to maintain your sanity, and communication is the key, which is very important. And speaking nicely doesn't cost anything. So training your staff and it is loose statements. Or we had a complaint from somebody who said कि हमें तो बोला था कि इधर ये नहीं है वो नहीं है तो आप private hospital में क्यों नहीं चले जाते? A loose statement like that inflames a relative who is already inflamed. And with obstetrics, I'm sure all of you remember the tragic case of Dr. Archana Sharma in Rajasthan. Now, that is because in obstetrics, you are expecting a healthy mother and healthy baby outcome. But death and disappointment with the treatment is inevitable in certain cases, even when the doctor or the team has tried to do their best. Now, how to deal with an adverse outcome, again, is first of all, of course, on the spot or while the process is going on of a bad patient or something where the outcome is not going well. You need to have regular communication point to point, preferably by a senior person, or in your private practice. If you are inside the OT dealing with it, you can request your anesthetist or somebody else who can go out and talk to the patient relatives while the process is going on. It sometimes happens that you make certain choices during surgery which may not have the best outcome. Few doctors have actually shut down their practice after they have had a death on table or an unfortunate event. Now, how do you deal with this? There's no easy or one stop answer for each of it, but it's a situation-based communication and documentation of the communication and what you call as crisis management. In corporate hospitals, you have teams and you have to report to the admin when there's a clinical incident which is going wrong even before the official complaint comes up. But when something has gone wrong, within your own team, do an internal audit and find out what went wrong or what could have been done better without pointing fingers, because it has happened with somebody. It should not happen with us in the next time. And in the NHS, billions, or rather millions of pounds every year are being spent to deal with complaints to the NHS, which is supposed to be a free government service, because people want to know what went wrong and why did the outcome not come well. And this is happening now. It's going to happen more in India also. So I feel this is an unfortunate way the medical practice is going, but we have to equip ourselves to deal with, and keeping yourself mentally grounded and calm is the bottom line to deal with unfortunate events and not let it, like you mentioned that beautiful story of the monks. Like we lost one patient. For 1 week, I was not able to sleep, but we had our internal audit. We discussed it, found certain gaps we could have filled better and certain things which we could not have changed. And then we all got a closure on that case. So these are important ways that you can go forward, even when things don't go the way you expected them to go.
Completely agree with you, ma'am. And with the Right to Information Act and everything coming in, things are going to get a little worse in India as well. But I think, as you suggested, and as Dr. Harish Shetty also suggested, having support groups, having our colleagues to talk to about the vulnerabilities, that will really help to lessen the burnout. And over to Dr. Nilima ma'am, please, requesting you to share your insights.
As gynecologists, we are having a lot of groups where we discuss our cases. So it really helps, because when you discuss your case, you find 25 other gynecologists who've gone through a similar complication, and then you realize suddenly that you're not the only one who has dealt with this. There are other people facing it. So you also come to know that your complication is not a complication done by you. It is the circumstances, the situation, the complicated case, what kind of a hospital you're working in, what kind of infrastructure you're working in, and then you realize that you have done your best. Today's program is about the physician's well-being. So here, your mental stress becomes less when you come to know that you have done your best, and in spite of that, something has gone wrong. Now to deal with that something that has gone wrong, that this case may future go in the court, and that also causes you a lot of stress. So having a personal and professional indemnity insurance for every doctor again is a stress buster, knowing that you are going to be well supported if at all this case goes to court of law, and that also helps you to deal with the stress. So AMC also, I'm not trying to promote the product. Please understand, I'm not trying to do that, but I'm trying to tell you that this is something which will keep you psychologically well balanced. You will have a support system with your association. You will have support system through people who are able to deal with this medical legal situation if you do land up with it. And that also helps you a lot psychologically. Thank you.
Absolutely, ma'am. My mother also, being a gynecologist, has seen all of these hurdles, and I have seen her go through all of that. So I do know what it's like to a little extent. Next, I would like to take Dr. Milan Balakrishnan. Can I please have your inputs on how to deal with 24/7 culture of patients wanting us to reply on WhatsApp messages immediately, and how it leads us to be burnt out?
Before that, I just want to add, Dr. Shetty sir spoke about how we need support groups, we need teams to be available when there are crises. I think definitely AMC as an organization has been doing that in a big way. That we have to remember how they've for this long they worked towards creating that support system, whether it's in cases of medical legal issues when people are put under the hammer, whether it's patient and relative aggression towards the doctor when we had the sort of security service provided. So all of these things are something that AMC has been doing over the years, and the whole need, I think, of AMC has been based around these very issues that we are discussing today. So I think that's something that I want to definitely mention before we talk about the 24/7 culture. Also, one more thing. There used to be, I don't know, there was this plan of setting up like a list of these problematic pathological patients, sort of a blacklist of patients who go from doctor to doctor and create trouble. And that talk has also been happening at AMC for a while, that we should see if we can create this list. And as psychiatrists, I think we also need to do that.
I don't think we can because it's a violation of human rights. Only of those who are convicted.
In the sense that
abroad
not a formal list, but
one of your friends will leak it. So what is very important is abroad, those who are convicted of such offences, you can make a list, but otherwise it will really cause a lot of trouble. Right. I think she's the best.
That is exactly why we encourage our members to put in complaints to the police station when they have these kind of patients, and then follow up that complaint so the conviction can happen. And once they are convicted, yes, then we can put them in that blacklist. But unfortunately, I also believe in human rights, and I feel if they are convicted, they are anyway punished by the court. And I hope that they have learned their lesson, and they have come back as new people, not wanting to trouble anybody. So again, putting them in the blacklist does not sound too good to me. But yes, we should be definitely warning each other in our own WhatsApp private groups. If you do have a patient who's coming, this a patient is in that area, he's going to go and trouble other people in that area. Very difficult for the patient to go somewhere very far to trouble somebody else. But your own colleagues, you can definitely make them aware of these kind of negative elements.
And also the fraudulent patients, those are a big newer problem now. And about about the WhatsApp culture, I think that's something that we all have to draw our personal lines. I think that's something that we need to very clearly determine that how are we going to be available all the time, what kind of fields we are in where we need to be available more often. So those are things that we very personally and individually have to draw lines. And I think most people have found their sweet spot in that sense.
WhatsApp again is going to now come under the NMC guidelines. So we are not going to be having that privilege of what we want to do on our WhatsApp. It is going to be under rules and regulations. So please hold your horses. Till then, yes, you're free to do what you want, but be extremely careful. It is a medium right now. Any social medium, you type anything, people can delete it also. So that conversation will lose its links and will not be medico-legally viable. So as far as possible, always be very vigilant and say that I am not comfortable with you chatting to me on the WhatsApp. Please come to my consultation room. I need to examine you. And if at all you're unable to come to the consulting room, take a ambulance and come over there, or have some kind of facility going to that place. But a medico-legal background should always be there at the back of your mind whenever you're dealing with social media and trying to prescribe any medications. I am very glad that the NMC has charted out a proper structure for this, and IT Act also is in place. So be extremely careful when you're trying to give any kind of advice on WhatsApp.
Thank you so much, ma'am. I think it has been a very, very insightful discussion today with all of our esteemed panelists. Before we end and before I summarize, I would like to request if any of our panelists here, sir, madam, would like to give in their inputs. So please.
There are a few questions still coming into the chat box. Akanksha, if you could just take those up, please.
Sure.
Milan, I have sent you a few questions on your WhatsApp that were there in the chat box and in the...
Yes, there's a question that I can see: how to resolve conflict in private practice regarding, are we doing justice to the patient with respect to service given to patient with limited resources, not giving the complete care with limited resources?
I think Nilima and Reena and Hemant would be able to answer that much better. Hemant, Nilima, or Reena, yeah.
Can you repeat the question, Akanksha, because I was trying to go through the other questions.
Sure.
So repeat the question for me.
The question that is mentioned is how to resolve conflict in private practice regarding, are we doing justice to patient with respect to the service given to patient with limited resources?
See, I'll answer in this fashion here. Basically, if in your mind or yourself, you are very, very sure that you have done a justice, okay? Because it is difficult to make anybody 100% satisfied 100% of the times. So there will always be some conflict. Now the question comes, from which side are you looking at it? Yeah, like in private practice, I tell you, the usual experience we hospital owners have is that at the time of admission of the patient or at the time of starting the treatment, everything is fine. Patient is very happy. The moment the last part of billing comes, and then there are frictions. So this is so very common. So we have to understand that how do we deal with that first ourselves. And that is only possible if you are sure within you that you have done a justice with whatever resources were there at your hands, whatever knowledge level you had. And secondly, if the desired outcome is not there, the guilt is not carried. Guilt tells you to introspect and understand where I have gone wrong. Was it that I did not take the help of my seniors or the others to understand something which I missed? Or was it for me to tell patient beforehand that this is something beyond my capacity or my setup that I'll be able to handle? If that is done and that has been taken care, then the guilt will not be there. You need not carry that guilt. And then if you are not carrying that guilt and you have explained thoroughly to the patient from the day one till end, I think the conflict will not be there. You have to be first very strong within you to understand that what you have done. And that gives you a power to explain and speak and convince. So I suppose that should be the way if we handle it in the private.
I have a different perspective to this. Your question was how to resolve conflict in private practice regarding are we doing justice? Are we doing justice to the patient with respect to service given to the patient with limited resources? All right, not giving the complete care with limited resources. Now you have to understand the kind of infrastructure that you have. You have to understand the kind of skill set that you have. We see a lot of times in private practice where we do not tell the patient about all kind of therapies which are available. For simple example, if I have to give, now I am a gynecologist and I am well versed with vaginal hysterectomies, and the patient has come to me for indicated hysterectomy, but she is not a candidate for vaginal hysterectomy. She may be a candidate for a laparoscopic hysterectomy, but I am not well versed with laparoscopic hysterectomy. So I try and convince her कि नहीं नहीं ये vaginal ही होना चाहिए, and then you land up with a complication. So I personally feel you need to look at it from the point of view of the patient and patient only. You have to give her the best advice from her circumstance as to what she can manage. You are not supposed to think of her purse and her monies involved. You have to tell her the entire basket and entire gamut of therapies that are available. And the call is hers to take as to where she wants to go. If you are not a laparoscopic surgeon, please tell her that. Please make it very sure that she understands that it is your lack of the skill because of which you are doing an open hysterectomy or a vaginal hysterectomy. But the choice has to remain with the patient. And if you have done that, and in spite of that, the patient decides to stay with you, then there is no question of guilt. But it should not happen that complete information was not given to the patient. Also, one more advice would be not to have ghost surgeons. If you are not doing a particular surgery and you are asking some other surgeon to come inside and do the surgery, please make the patient aware that some other surgeon is coming and operating, because tomorrow, in case of a complication, that will become a very big problem for you, and the guilt factor can turn in. Infrastructure wise, whatever you have, do only what is possible to be done in your operation theater. A high risk patient your nursing home is not able to handle, please do not handle it in that setting. Transfer her to a tertiary care center. That is my take on it. Akanksha.
From my end, I want to ask a question, because it's something that I sometimes think I struggle with. Especially, we talk often about medical jousting, right? We talk about how doctors may talk about other doctors, etc. I find myself sometimes struggling with, a prescription that makes me uncomfortable. And I know I'm not saying anything, but I'm sure the way I look at that prescription and the way my gestures are, if the patient is very, very sensitive to those, he will pick up that there's something wrong. There's something that's nobody's ever asked me this, but I've always felt this internally, and I would try very consciously not to not to react like that, but it does happen to me. So I'm sure it happens to a lot of us, and we try very hard to sort of not say things directly, but we may in a lot of ways express things that may make patients feel uncomfortable. So I don't know. I think I'd like to hear from others what they think about this and what they do in order to sort of help themselves.
Harish sir, can you answer that?
So
Unmute yourself, please.
Audio, sir.
Across time, I've learned that body language is read first, then the words. So when you hold a prescription, be mindful of what you're seeing. Maybe at that point of time, that patient required those medications. Who are we to judge? Our science is not an exact science. This is not quantum physics. So very consciously, across many years, I've been saying that he's a good doctor, and probably he felt this is what you required. And probably now is something that what you would feel is required. Most of the times, patients are very happy to hear criticisms, even subtle, nuanced, about other doctors. And what happens after that is they lose faith in you also. Say, for example, somebody is depressed and is seeing a psychiatrist. But when he has come to me, he or she is worse than what she was at that point. And I would say, you need this treatment. And they would say that, "Unhone humko ye sab kyun nahi bataya?" And then I say, at that point of time, in his wisdom or her wisdom, this was the right treatment. That is very important. Now, when you see very gross, say for example, somebody is giving ECTs for a gay patient or something which is not very appropriate, I would still say that this may not be appropriate, but this is what I feel. So it's very important for us to understand that we need to close ranks because none of us are perfect. None of us are perfect. We need to close ranks and we need to actually be conscious and mindful of your body language. Somebody would say hysterectomy avashyak hai, and I have sent a patient to 2-3 gynecologists. One said hysterectomy, second one said no hysterectomy, third one said maybe it's your wish. And the patient actually came to me and said, what should I do? I said, go back to, of the three doctors, go back to that doctor who provided evidence to you of why and what, or go back to all 3 doctors and have an open, free-wheeling discussion. Go back and take a half-an-hour appointment, pay for that appointment, and have a free-wheeling. I think we need to be very careful. We should not protect criminals, but I think we should close ranks and be very close. Patients also exaggerate the negatives of the earlier doctor. So that's, human beings by nature gossip, and also the Chinese whisper goes inside the Tanasa Sangitla, Tanasa Ka Sangitla, and then what they come and tell you is totally different than what actually happens. So we need to be mindful. I think all doctors should do some mindful exercises, which I think is very, very important. Whatever you like, you can do Preksha Dhyana, you can do Vipassana, you can do yoga, you can do Isha meditation, Shunya, you can do Sudarshan Kriya, whatever. The mindfulness is important. And what you tell yourself, the internal dialogues in your mind which is happening when you hear a name of a gynecologist or a psychiatrist whom you don't like, what happens at that point? तभी थोड़ा 10 सेकंड चुप रहने से अच्छा रहता है, बाद में सेंटेंस सही निकलता है. But if you abruptly say, then you are emotionally hijacked and your amygdaloid works rather than your prefrontal cortex. And that, I think, is something we need to avoid consciously. By nature, human beings see differences. But by attitude, we should not discriminate. And that, I think, is so important. Thank you.
Certain jousting, I think, is one of the mainest reasons why people go to court. And we as colleagues need to help each other out over here. And like Harishana said very, very rightly, if it is not a major mistake, see, because it is your perspective, it is your experience. That doctor would have done it from his experience and his kind of practice. So that is exactly what you try and say to your patients, okay, in my opinion, this is what I feel is the best. And the other doctor, in his experience, must have felt this is best for you. Now it is up to you to take a decision whom you are more comfortable with and what therapy really agrees with you. But when a patient agrees with a particular therapy, there are very less chances of that patient coming back and saying that things have gone wrong, because you have given the choice to the patient and he has chosen a particular therapy. So then he cannot go back and say, oh, you did not tell me this and you did not tell me that. That is why I said information about no therapy, your therapy, other therapies, everything has to be given to the patient, and the ball always has to be in the patient's court. Harishana also said very, very rightly that patients get confused. So I always tell my patient that please sit across, go back home, mull over whatever I've told you, come back again with whatever doubts you may be having. I also make it a point to tell my patient, whenever you're going to come for a follow-up, please make a doctor's diary. Write down your queries and we will answer everything. So patient also feels comfortable, yes, this doctor is willing to tell me everything that I ask. And that is where patient satisfaction is also very important. Harishana, Milan, and Akanksha, both of you are three of you are qualified psychiatrists. My question to you today is, as doctors, or our marriages is such a big problem, because once you are married, it is a couple, and that causes so much stress. If you're married to a doctor, I think it is more of a, we think that we understand each other very well and all that. So what do you think is the best way, to resolve issues amongst our own marriages to make us happier when we go back to the consulting room? And also about, we never talk about doctors' sex lives, and how can doctors themselves improve that to be happy, because I personally feel that that's a very essential ingredient of happiness. And today we are talking about doctors' happiness. So marriage and sex life is what I want you all to just touch upon before we finish this webinar.
Well, the first thing which is very important is that you marry the best available at that point of time, love marriage or arranged marriage. Life is all about the best available. You elect a prime minister, it is the best available. You buy a fridge, it is the best available. Only thing is you can replace a fridge easily, but if you have to say that you want a new wife or new husband.
Harish, little louder.
Can you all hear me?
Yes, we can hear you now.
Okay,
yes.
I repeat. Marriage is basically something which we choose to marry, love or arrange, and at that point of time, the best available match. It's always about the best available at that point of time. And it's true about choosing a prime minister or electing anybody or buying stuff. Only difference is that you cannot say after 5 years, I see somebody now who's much better than my husband or my wife. So what is very important is to accept that marriage can be boring. Even if you marry Brad Pitt or Sophia Loren, the same Brad Pitt or the same Sophia Loren, the same fart, the same perfume. It's difficult. Some people say love marriage is much better than arranged marriage. And I would say that love marriage is basically heart to the hip. You start a conversation and then you meet. Whereas in arranged marriage, it's hip to the heart. You start making love in honeymoon and then start your conversation. Both are the same. A into B is equal to B into A. So there's no difference at all in terms of looking at cases in the marriage court in Bandra. What is very important is physical exercise, sleep, and exploring each other keeps marriage and sex alive. I know of hundreds of couples among doctors who have sexless lives. And that only has happened because of bad lifestyle. And that is something we need to really look at. Now, also what is important is the endocrinological profile of a human being goes haywire when your lifestyle actually changes. And so I always say that small touch is as important as heart touch, which means it's important to cuddle. It's important to have Mundi Mandi philosophy, which I think people have heard. Mundi Mandi philosophy is the laptop philosophy. To mato kholo, your head on my lap and my head on your lap. The soft touch keeps the heart touch actually revived. And the third thing which is very important is look at your physical health, your diabetes, your sugar, and your sleep, and actually other things. How do you resist temptation is also a very important issue, which is important. Sometimes you might have married the right person or the right woman, and you really don't get along with the person at all, and you're pulling on. It's good after all attempts. It's good to say, divorce mein na to shan hai, na to sharam hai. It's good to separate at the right time. So marriage is something we need to work on. It won't happen just. It's like a car. You need to really refuel it every 5,000 kilometers. You need to put oil. You need to put actual coolant. It may be a great car when you buy it. Maybe a shining car when you buy. But to keep the shine on, you need to really work. It's hard work, and that I think is the most important. Also, one needs to understand that in marriage, love may have birth, growth, and death. You may be intensely in love, but slowly you may have death also. And sometimes it's important to understand that rebirth can also happen. It's good to be away from each other to get back to each other. And that I think is extremely important. You need to be away to be back. So I would say all doctor couples should stay away for at least 1 month in a year away from each other. And that I would say is also important. But managing your anxieties, managing your diet, managing your health, and managing hormones and lifestyle would mean that you would have reasonably good sex lives as well as a good marriage. So those couples who don't share their feelings and don't share their issues with each other also are in deep trouble. But those who share the issues and feeling continuously also get bored of each other. So a lot of simple things to be done. There's nothing like love marriage much better than arranged marriage. And so A into B is equal to B into A. Well, marriage is all about head to head, lip to lip, heart to heart, and hip to hip. 50% is passing. And what 50% you have to choose.
And
At the same time, I would also want to add that a lot of marriages are very spiritual marriages. They have renounced their sex lives and they are into a spiritual journey. I perfectly understand, except that if it's their choice. So being spiritually close and being companions to each other without meeting is perfectly all right if they believe and accept it. And that I think is important. But you know what happens in our field is a lot of couples get close and involved, or even attracted to people in the same profession with whom they work. So remember one thing: three is always a crowd. And ishq aur mushk kabhi chupta nahi hai. If you feel you can hide it, ishq aur mushk to kabhi chupta nahi hai. And at times it is physics. You like the physical appearance. Then it is botany and geography. You like to go around trees and parks. And then it is zoology. And then you love to mate. And then it is angioplasty and angiography and so many other things. तो जो अपना है वो अपना है, कैसे भी हो, थोड़ा मोटा है, थोड़ा तोंदा है, थोड़ा बाल गिर गया. So keep on changing. Your album picture will not last for life. It will keep on changing. So that the deep acceptance of a spouse is something we learn across time, even by mistakes. There are mistakes, and that I think is very important. And if there's any issue between each other, you need to take care. And one thing I would like to add is, sometimes masked depression can destroy a marriage. In fact, I still remember this doctor couple. The girl said, I want to jump down the 15th floor. The girl's parents accused the boy, and the boy said, I would not stay with you. Please stay with your mother. And I found that she had clear major depression, nothing to do with the husband. And it was so difficult for me to accept, to ask them to take 50 milligram of sertraline. And she would refuse. After 3 months, she agreed, and she became all right. And now after a year of treatment, they're perfectly all right. And they came and said that they were laughing at their entire fight. So sometimes depression, masking, either of them couple, man or woman, can lead to a difficult marriage. And this mass depression may be not easy to identify unless you see a psychiatrist. I would emphasize psychiatrist.
Thank you, sir.
Milan, your take on it?
Completely agree with sir about the. I'm sorry, Dr. Milan, sir, please go ahead.
Yeah. I think Shetty sir has covered it almost all. He's left nothing for either of us to speak.
And Harish can speak for one complete session only on this topic, but he did not touch upon the being judgmental and being non-judgmental in the relationship, whichever way you are, whether it is husband, wife, friends, patient, or in society. So that is one point I think Harish has not touched upon.
Akanksha, you wanted to say something?
No, I would like to say something here. We all have touched it in indirect ways. Indirect ways is if you're aware of your thoughts, feelings, you become less judgmental. You may not be completely non-judgmental. If you're mindful about your lives, you become less judgmental. And as you learn from each other and accept mistakes and learn from the mistakes, your hug size increases. And you say, well, uska ye soch hai, and it's perfectly all right. And God is a champion of diversity, and man is a champion of structure. He makes 7 billion different human beings across the world. And then slowly, as you mature, as you also age, and as you also learn, so there are 3 words, Hemant: habit, experience, and wisdom. Doing the same things again and again is habit. You don't learn from it. You will judge the person every day. You will judge your patient. You will judge everybody. But learning from that habit is experience. Learning from experience is wisdom. So what is very important is even after this talk, my thoughts will come up. मैंने शायद ये ऐसे बोलना चाहिए था. मैंने शायद ये, and then I'll say ये mistakes मैं अगले बार नहीं करूँगा. So learning from every experience makes you non-judgmental. It is not an injection or a technique or a technology we can teach. So being aware, Hemant, and being aware of your thoughts, feelings, sensations, and being a little mindful is important. And lastly, I always ask people, how does a smile work? What is the importance of a smile? People say happiness, this, that, and those. But I say no. Smile is a sign of respect. I accept Hemant exactly as he is. 10 years ago, I never felt, or I never imagined, or never knew that on this day, I, Hemant, Nilima, Akanksha, Milan, and Dr. Vani would be together. So Kainat has brought us together. Prarabdha hai ye. और ये योग है कि हम साथ में आके काम करते हैं. So I respect you for exactly what you are. I may not like your language or affiliation to a political party or the way you have coffee making noise, but the point is I respect you exactly as you are and accept you exactly as you are. And that I think makes you less judgmental without using the word being judgmental. Thank you for the provocation, Hemant. You really provoke us and make us think beyond what we should actually think. And thank you, my dear Nilima, for asking such difficult questions.
Akanksha, you had something to say, and you were...
Yes, ma'am. I think Dr. Harish Shetty sir has really beautifully summed up the question on marriage and how to be happy in that. And I completely agree, sir, with your words that accepting our partner unconditionally, वो अपना है, वो अपना ऐसा ही है. Accepting that is, I think, the first step. My husband is also a doctor. He's an endocrinologist. And I would like to add a point that as doctors, as it is, we are very busy. We are short on time. So we have very little time for spouses. And the equation worsens after you have children. So we realized that after we had our son, and there's very little time that we are able to devote to each other. But I think in that little time, what we can do is, as Harish Shetty sir also said, instead of focusing on the flaws, trying and complimenting each other on what qualities they have. We all have a checklist when we decide to look for a partner. So trying to recollect that checklist and picking out the positives that, oh yes, this was why I married him in the first place. And remembering that and being grateful for that is something that helps, I think. It is in the small things, as Dr. Harish Shetty said. Yes.
My question specifically today was because all of us are doctors over here. We are here for the doctors' happiness. marriage is a very, very important part. And I see we have a portal for marriages, and a lot of doctor parents, insist on their children who are doctors to marry doctors. Now, that is a very complicated situation and a very difficult situation. And I honestly would advise everybody that marriage is a marriage. It is not a business contract. So you have to marry for the right reasons. A gynecologist marrying an anesthetist, so we will have a beautiful team afterwards for our business, should not be the aim, which is what I'm seeing right now in the market going on. And when you marry, you're young, you're just getting into practice. Tomorrow, your partner may not do as well as you will do. He may go way beyond you. You may go way beyond his expectations, but you are still remaining the do pahiye of that particular vehicle. So you have to balance out, you have to manage, and a marriage is finally not with a professional. A marriage is with a human. So to keep the marriage alive, you have to work on it, you have to nurture it, you have to give it that top priority. Your kids also come into the picture, and then things, like Akanksha said, do get complicated, and that is your challenge. To keep it alive, to keep the spark alive is something you have to work on. And as medicos, people keep asking me, your husband is a gynecologist and he is examining women day in, day out, so how is the spark in your marriage? So all male gynecologists' wives do get asked this question. All right. So as doctors, I would please tell you all, please respect your partners, let them do what they have to do, keep that faith, have that trust, because you are out in the market, you're meeting people day in, day out. It is like the film profession, where you're exposed to so many people, your patients, but you are bound medico-legally again. So no outside alliances where that is concerned. And marriage is an institution. It is part of your life. It is integral to your happiness. So work on it, nurture every relationship possible. Today, we have managed to touch upon a lot of aspects: your personal aspect, professional aspect, financial aspect. Depression is one question which is coming up every time on our chat box. And my advice to all the doctors here is that though you are doctors, you are humans first. You can go through same problems that anybody else can go through, and mental health is an important thing. If you are mentally strong, you can treat your patients well and you can guide them well. So take professional help whenever possible, and please go and see some kind of a mental health professional whenever you are in the need. Thank you. And that is all from my side. Over to Hemant for the vote of thanks. Akanksha, fabulous job done. Milan, I'm so proud of you. You're the junior most in my team today, but you've done a wonderful job. Harishna, a personal thank you from me. You are my favorite.
Nilima, Akanksha, I think, became a member of AMC just a few days, because I think 2 days or 4 days back I approved her membership. So I remember that very clearly. And after that, I saw that.
Girl you got to our association. Akanksha, welcome.
Thank you so much, ma'am. And I am really honored to be here with all the esteemed panelists today: Dr. Nilima ma'am, Dr. Reena Vani ma'am, Dr. Hemant Duggad sir, and of course, Dr. Harish Shetty sir and Milind Balakrishnan sir. You have been my guide and mentor. Thank you so much. It was an honor being here.
Hemant?
Yeah, Rahul, I think, left, but it's my proud privilege as the Secretary of Association of Medical Consultants, Mumbai, to propose a hearty thanks for our President who initiated this webinar, our PCC, and Dr. Reena Vani for heading the team, and of course Milan and Akanksha. Milan is the first timer in our managing committee, and Akanksha a new entrant to the AMC family. Both of you handled it so well that I'm sure the remarks what I'm reading in the chat box, that people, more than almost 300 delegates were there, and all 300 were very satisfied, and the satisfaction brings happiness. And Harish, my dear friend, I mean, he just doesn't, wherever he is and whichever format you put him to speak. Today, probably he did not get that much of time, but otherwise, singularly, he would have handled this webinar for 2.5 hours. So, thank you, Harish, for being on this platform with us. And thank you, all the delegates, for sparing time, remaining with us. And I'm sure all the take home messages, what you have received, will help you in your personal life, in your professional life to excel, because something doing just a niche above is the excellence. And that is what we are trying to give you, this platform of Association of Medical Consultants. Thank you. Thank you
I would
very much.
also want to thank the panel, extended panel of Dr. Nilima, Dr. Reena. Actually added pearls of wisdom and very valuable advice, and I've learned a lot from each one of you. I take a few points which will help me enrich my next seminar. Thank you.
You know, we were by default, I don't know, because initially when I saw, I said that otherwise my role is to just start the function and end the function. Being a secretary, I don't have much role to play, and Nilima doesn't allow that much beyond that role. But today I got a lot of...
That is something I will not accept, Hemant. I will not accept that comment from you at all.
So definitely we got a chance to speak, and all of us are psychologists, psychoanalysts, by virtue of our so many, I mean, the medical background and the so many years what we have passed into the practice or the public domain. So it was a very easy intermingling and seamlessly moving from a psychiatrist to a non-psychiatrist. Thank you. Thank you very much.
Thank you, everybody. It was a pleasure to be part of it. Harish Anna, wonderful to listen to you and interact with all our team. Thank you so much.
So should I end the meeting?
Yes. Thank you so much.
Thank you. Thank you all.